Ever feel like your understanding of a topic is kind of like Swiss cheese? You've got the basic gist, but then there are these gaps.
Definitely.
Well, today we're doing a deep dive into acute liver failure, or ALF, to try to, fill in some of those gaps. We're going to uncover some surprising insights from this, honestly, pretty dense medical seminar.
Yeah.
But we're going to, unpack it all. We're talking rapid deterioration of the liver, the immune system going kind of haywire, and even how, get this, your zip code can play a role.
It's wild, right? I mean, it's fascinating how this research connects the dots between global health trends and your individual risk for ALF. Like, it's not just about understanding the science. It's about, grasping the bigger picture.
Right, because anyone who's even glanced at a medical journal knows it's not exactly light reading.
Definitely not.
So we're here to break down this complex condition. You've probably heard of liver failure, but ALF is different. It's not a slow decline.
Right.
It's more like hitting a brick wall, health-wise.
Exactly. We're talking about your liver losing its ability to function in a matter of days, sometimes even hours. And what's striking is that it can happen to anyone, even those with no history of liver problems.
And when they dug into the causes, it turns out where you live can be a surprisingly good predictor of why you might develop ALF.
Yeah, it really highlights how interconnected health and environment truly are. For example, the seminar talks about how in South India, a significant number of ALF cases are linked to yellow phosphorus poisoning.
Oh, wow.
It's a common ingredient in rat poisons there, easily accessible, and sadly, accidental ingestion is a major issue.
That's a chilling thought. Something as simple as pest control having such dire consequences depending on where you live.
Precisely. On the flip side, the seminar points to the incredible impact of vaccination programs.
Yeah.
In many parts of the world, hepatitis A used to be a leading cause of ALF. But thanks to widespread vaccination, those numbers have plummeted.
Yeah.
It really underscores the power of public health interventions.
It's like a global game of medical chess, isn't it? But let's zoom in from the global perspective to what's actually happening within the body when ALF strikes.
Okay.
The seminar uses the phrase, the body under siege, which sounds pretty intense.
It is. It's a bit of a biological betrayal, honestly.
Wow.
Imagine your immune system, your body's defense force, suddenly turning against you. Instead of targeting the real threat, like a virus or a toxin, it starts attacking healthy liver cells.
So it's like your body is waging war on itself.
In a way, yes. And the seminar does a great job of outlining this cascade of events.
Okay.
Starts with some initial trigger, the thing that causes the damage, then inflammation kicks in, cells start to die, and if it's not caught early, the liver just shuts down.
And let's say someone is showing signs of ALF. Can doctors predict who will recover and who might need a transplant?
That's the million-dollar question. And the seminar delves into the various prognostic models doctors use, things like the King's College criteria, or KCC, the Acute Liver Failure Study Group Index, or ALFED, and even the more recent Biley score, which looks at bilirubin levels and INR measurements. Those are both indicators of liver function.
Okay, so we're getting into the nitty-gritty of how they assess the severity of ALF.
And while these models are sophisticated, they're not foolproof. There's always an element of uncertainty, which is what makes managing ALF so challenging.
So it's not just about treating the liver, it's about supporting the entire body through this incredibly intense process.
Absolutely. We're talking about managing brain swelling, which can be a life-threatening complication, fighting off infections because the liver plays a vital role in immunity, and then there's the whole issue of blood clotting.
Yeah.
It's a delicate balancing act.
It's almost like ALF throws the body's entire system out of whack.
Exactly, and the blood clotting issue is a prime example.
Hmm.
The seminar challenges this assumption that, in liver failure, you just need to prevent bleeding.
Because I'll admit that's kind of what I would have assumed.
Right. Seems logical. Right. But ALF can actually swing the pendulum in both directions.
Okay.
Like 1 minute, you're at risk of excessive bleeding. The next, you're dealing with dangerous clots.
Oh, wow. So how do they even begin to manage that?
It's about constantly monitoring and adjusting. So the seminar dives into how ALF can disrupt this balance of clotting factors in the blood. It's like a recipe where the slightest imbalance can completely change the outcome.
Talk about a high-stakes balancing act.
It is, and it highlights why specialized care is so crucial for ALF patients. But on a more positive note, the seminar does go into some promising treatments that are showing real potential.
Okay, so there's hope on the horizon. Tell me more.
Yeah, there's a lot of talk about continuous renal replacement therapy, or CRRT.
Okay.
It's like dialysis, but for your blood. So it filters out toxins and excess fluid that the liver can't handle.
So it's kind of taking some of the burden off the liver while it tries to recover?
Exactly. Another therapy they highlight is plasma exchange. Think of it like swapping out your blood's software with the first install.
Okay.
It can help rebalance those clotting factors we talked about and remove harmful substances.
That sounds incredibly high-tech. I imagine early intervention is key with these treatments.
Absolutely. The earlier the better. Catching ALF in those early stages can be a game changer. Like it gives these therapies the best chance to work and potentially prevents the need for a transplant.
Which brings us to liver transplantation. The seminar dedicates a significant portion to it. It's still considered the ultimate solution for many ALF cases, isn't it?
Yeah, it's often seen as the last resort, especially in those most severe cases where the liver is failing rapidly. The success rates have improved significantly, but it's still a major procedure with inherent risks.
Right. There's the surgery itself, the lifelong need for anti-rejection medication, and of course the ever-present challenge of finding a matching donor.
Exactly. And the seminar doesn't shy away from these complexities. There's the ethical considerations surrounding organ allocation, the fact that not everyone is eligible for a transplant, and the reality that even with a successful transplant, life afterward comes with its own set of challenges.
So while transplantation can be a lifesaver, it's not a perfect solution. Are there any alternative approaches on the horizon?
That's where the research gets really exciting. The seminar touches on some cutting-edge technologies like hepatocyte transplantation. So instead of transplanting the entire liver, they're looking at transplanting just the liver cells, the hepatocytes.
It's almost like giving the liver a boost of fresh troops rather than replacing the entire army.
Exactly. It's a less invasive procedure
Mm.
and could potentially address the donor shortage issue, but it's still in the experimental phases.
It seems like research is constantly pushing the boundaries of what's possible in ALF treatment.
Absolutely. And one of the most intriguing areas of research highlighted in the seminar is its focus on regenerative therapies.
Regenerative therapy. So that's about helping the liver repair itself.
Precisely. They're exploring the potential of stem cells to regenerate damaged liver tissue. Imagine if we could coax the liver into healing itself. That's the ultimate goal.
And what about new drugs? Are there any promising leads on that front?
The seminar mentions ongoing research into drugs that could suppress the immune system's attack on the liver or promote liver cell regeneration. It's a rapidly evolving field with a lot of potential.
So it sounds like there's a lot of hope on the horizon, but still a long way to go in fully understanding and treating ALF.
Exactly. But I think that's the key takeaway here. The medical community is making significant strides, but it's a complex puzzle with many pieces still being investigated.
And that brings us to the final and perhaps most thought-provoking point the seminar raises. What if we could detect and treat ALF even earlier, before the symptoms fully manifest?
Now, that would be a paradigm shift in how we approach this condition. Instead of reacting to a crisis, we'd be one step ahead, intervening before the damage becomes severe.
It's like that old saying, an ounce of prevention is worth a pound of cure.
Exactly. Early detection could be a game changer. Imagine if we could identify individuals at risk, maybe through advanced blood tests or genetic screening, and intervene early to prevent ALF from developing in the first place.
It's a powerful idea, but it would require a deeper understanding of the very early stages of ALF, wouldn't it? Like, what are those first dominoes that fall, leading to the cascade of events we've been discussing?
Those are the million-dollar questions, and that's the challenge the seminar throws down. How can we leverage our growing knowledge of ALF to develop better diagnostic tools and preventative strategies?
It's a challenge that has the potential to transform how we approach, not just ALF, but liver health in general.
It's a reminder that knowledge is power. The more we understand about a condition like ALS, the better equipped we are to advocate for ourselves and our loved ones.
Absolutely. It really makes you think about the future of medicine, doesn't it? Shifting from treatment to, like, prediction and prevention.
It's a fundamental shift.
Yeah.
And this seminar, it really drives that point home. Imagine a world where we can identify, those at risk for ALF before the damage even begins. I mean, it could be life-changing.
Talk about turning the tide. We've talked about the science, the treatments, but it seems like the biggest questions are still out there, waiting to be answered.
And that's the beauty of research, isn't it? This seminar isn't just presenting facts, it's like issuing a call to action. More research into early detection, into regenerative therapies, into understanding the intricacies of the immune system's role in ALF. These are the frontiers.
It's like this entire deep dive has been leading up to this point, The future of ALF treatment isn't just about new drugs or procedures, it's about a fundamental shift in, our thinking.
Precisely. It's about moving beyond managing the damage to preventing it in the first place. And that requires a collective effort.
Mhm.
Scientists, doctors, policymakers, even patients themselves, everyone has a role to play.
It's about empowering people with knowledge, so they can advocate for better care and support for ALF research.
Absolutely. Knowledge is power. And the more we understand about ALF, the better equipped we are to make informed decisions about our health and the future of this field.
This has been an incredible journey into the world of acute liver failure. We've gone from the global picture right down to the cellular level, uncovering the causes, the challenges, and the glimmers of hope on the horizon.
And hopefully we've left you with a deeper understanding of this complex condition and a sense of optimism for the future of ALF treatment.
If you're looking for more information about ALF, we'll be sure to link to some reputable resources in the show notes. And as always, if you have any concerns about your liver health, please reach out to a healthcare professional.
They can provide personalized guidance and support based on your, individual needs and circumstances.
That's right. And remember, staying informed is the first step towards taking charge of your health. Until next time, stay curious.